My name is Mehdi. I'm a neurologist and an academic who works at the Brain and Nerve Research Centre at Concord Hospital. The ALS is a devastating neurodegenerative disorder. It usually starts with focal weakness in one part of the body. Maybe someone's swallow or speech, their hand or leg might drag along or something like that. But the thing that's key is that it's progressive and the muscle weakness spreads everywhere. And affects all muscles, and often people pass away from respiratory insufficiency. They can't breathe. The muscles, the work of breathing, they can't maintain themselves, and so they pass away in that way. And it's quite a rapid disorder. Most people from onset symptoms and diagnosis, they live about 3 years, and there's no known cure. And the treatments that we have only modest efficacy, shifting the kind of survival period maybe by 3 to 6 months, depending. In this grant, the grant that we've applied for essentially is relates really to the origins of the disease and the fact that there's no real known cure, and it's hard to diagnose. So we know there's a good signature for the origins of the disease actually starting in the brain, and that actually um, has its history in the origins of the disease's first descriptions. But it was kind of lost for a long time, and it's now, with more recent research, has come on and to a more clear understanding. But those sorts of the kind of features that allow us to demonstrate that there's activity in the brain that's abnormal are not easy to do, and they're not widespread throughout the world, and they remain technical techniques or hard techniques. So what we essentially are trying to do is use a simpler method, recording brainwaves, and use that to develop surrogate markers of the abnormalities we see with these more complex TMS techniques on the resting brainwave recordings that we can do for just an ordinary person sitting there with just with their eyes open for 5 minutes and making a recording of the brainwaves. And why is that important? Well, there's three different questions we're answering in the grant. One is to help, pick up earlier features of the disease because we think it starts in the brain. So looking more directly there will help us narrow or identify the causes a bit better. Um, the second part really is developing a model of neurophysiological markers that might predict prognosis more accurately. We have a whole range of clinical things, but really the biology isn't something um, that's readily translatable to that same prognostication. And then the last thing is, so in terms of diagnosis, early prognosis, and then also some of the features of the abnormalities in the disease, the overexcitation of certain brain circuits, which we can measure with more complex techniques using something called TMS. Those things, again, are hard to demonstrate. So we're trying to use brainwave activity, which would be more easy for other people to undertake, um, to demonstrate these features of hyperexcitability. Now, capturing that diagnosis or that information with the resting EEG will also help us to um, provide a better model by which to track responses to therapeutic interventions, of which we don't have any at the moment. So essentially, our research aims to bring forward the window of diagnosis using a simpler technique, which is more accessible. We also hope to kind of develop better markers of the biology or the abnormal, in medical terms, pathophysiology, but the biology of the disease, and then enable them thereby to be targeted with and measured in, early drug trials, and to better identify which drugs are actually going to help and which ones aren't. And then they're the key things to kind of early diagnosis and help improve biomarkers that we can use to improve outcomes in clinical trials.